Now we're going to see the different types of diagnosis of pregnancy. We have three types. We have presumptive diagnosis of pregnancy. We have probable diagnosis of pregnancy. And we have definitive diagnosis of pregnancy. Presumptive diagnosis of pregnancy are things that are not related to the fetus nor to the uterus. For example, nausea or vomiting, that this occurs in the first trimester of pregnancy, or for example some physiologic changes we have during pregnancy, like skin hyperpigmentation or stria, or for example if the patient has breast tenderness. These are things that are not related to the fetus nor the uterus. Probable diagnosis of pregnancy. These are things that are related to the uterus or to the feeling of the mother. For example, if the mother feels the movement of the fetus, this is a probable sign of pregnancy. If we have an enlarged uterus, or if we have increased serum or in urine beta HCG, this is a probable diagnosis. I mean, several times we do diagnosis of pregnancy based on this, but this is a probable sign of pregnancy, not the definitive sign or the definitive diagnosis of pregnancy. Normally, when the mother starts to feel the fetal movements is around 16 weeks for multipary women and around 20 weeks for a nulliparous woman. And now definitive signs of pregnancy. These are the one of the fetus. For example, if we have an ultrasound and we find the gestational sac in the uterus, this is a definitive sign of pregnancy. If for some reason we get some X-ray and we find the skeleton of the fetus, I mean, indeed we are seeing the fetus, so this is a definitive diagnosis of pregnancy. Or if with a Doppler ultrasound we listen to the heart rate of the fetus, this is a definitive sign of pregnancy. Or if the fetal movements are felt by the examiner or someone that is not the mother, someone external to the mother, let's say the doctor. And so we have presumptive signs of pregnancy, probable signs of pregnancy, and definitive signs of pregnancy. Presumptive are not related to fetus or uterus, like nausea, vomiting, skin changes, or breast tenderness. Also, amenorrhea is a presumptive sign of pregnancy. Probable signs of pregnancy are related to the uterus or to the feeling of the mother, like sensation of fetal movements or enlarged uterus or increased amount of beta HCG. And definitive signs of pregnancy is indeed looking or listening to the fetus, like an Doppler ultrasound, listening to heart sounds, X-ray, seeing the skeleton of the fetus, or an ultrasound finding the gestational sac and or the fetus, or an examiner feeling the fetal movements.